There are numerous bacteria that can cause disease in humans, but the good news is that almost all infections that we treat on a daily basis are caused by only a handful of species. And these bacteria are not only the most common causes of illness, but they are also typical representatives of entire groups of pathogens. So if you understand a few basic things about them, you will have absolutely no problem understanding antibiotics. What's even better, you will quickly realize that you are already familiar with most, if not all of them. They are that important. So let's start simple with group A Streptococcus. This bacterium is famous for being the most common cause of bacterial pharyngitis, also known as strep throat. And yes, it certainly can cause a nasty tonsillar pharyngitis, but more commonly, this bacterium is just an innocent bystander, especially in children. About 10% of children are asymptomatic carriers, meaning that this bacterium usually just colonizes the pharynx without causing any symptoms, without causing a true infection. Besides the throat, it's also commonly found on the skin, and just like with the throat, it usually just colonizes the skin, but occasionally it can cause infections of varying severity. Most commonly it infects the outermost layer of the skin where it causes impetigo or erysipelas, but rarely it can also infect deeper layers and cause even life-threatening necrotizing infections like fasciitis. And since there is a group A Streptococcus, it's safe to assume that there are also other groups, isn't it? There are many different streptococci that colonize the mouth, the skin, the gastrointestinal tract, and the genital mucosa. But there is no need to get into a lot of detail here because they're all members of the same family, and in terms of antimicrobial susceptibility, they are all very similar, and more on that in the upcoming lectures. There is only one more prominent member of this family that deserves its own place on this short list, and this is Streptococcus pneumoniae, aka Pneumococcus. Just like group A Streptococcus, most of the time this bacterium is just an innocent bystander that simply colonizes the upper respiratory tract. And just like with group A Streptococcus, children are often asymptomatic carriers. However, given the right circumstances, it can cause serious infections. In fact, Streptococcus pneumoniae is the most common cause of all bacterial respiratory tract infections besides bacterial pharyngitis. As mentioned, this is group A Streptococcus. Pneumococcus, on the other hand, is the main cause of community-acquired pneumonia, otitis media, and bacterial sinusitis. Whenever you hear about one of these infections, Streptococcus pneumoniae should be your number one suspect. It's also the most common cause of bacterial meningitis, and it's not difficult to see why. From the ear or from the sinuses, it's a very short trip to the meninges and the brain, and if it doesn't enter the intracranial space that way, so directly, it can first get into the bloodstream and then end up in the central nervous system. I cannot overstate the significance of this pathogen. You will be targeting Streptococcus pneumoniae over and over again with empiric therapy for community-acquired pneumonia, bacterial sinusitis, otitis media, and, of course, bacterial meningitis. Now, being a member of Streptococcus family, in terms of antimicrobial susceptibility, it shares many similarities with other streptococci, and you will see that in the upcoming lectures, but generally speaking, it's more resistant than your average Streptococcus. Morphologically, what all streptococci have in common and what makes them streptococci in the first place is their appearance under a microscope. First, they are all dark blue, meaning gram-positive. What makes them blue is the staining process that is used to make bacteria more visible with microscopy. I'm sure you've heard of that, the famous gram stain. Bacteria that appear blue are labeled as gram-positive. Second, streptococci are round like little berries. In Greek, cocci means berries. And third, they come in chains or pairs, and this is how they got their name. In Greek, streptos means chain and coccus means berry. So, streptococci are gram-positive, round bacteria that come in pairs or chains. The reason I'm pointing this out is that there is another group of very clinically significant round blue bacteria, only they don't come in chains but in grape-like clusters. And this is why they are called Staphylococci. In Greek, staphyle literally means a bunch of grapes. The king of Staphylococci is the bug you've all heard of, Staphylococcus aureus. In Latin, aureus means golden. It got its name because its colonies appear golden on agar, and the name really fits because this is one of the most important pathogens in human medicine. Staphylococcus aureus predominantly colonizes the skin. We all have it on our skin from time to time, and just like Streptococci, usually it causes no trouble at all and just colonizes the skin. But all it needs is a wound, a scratch, or even a microscopic injury to get into the skin and cause infection. Staphylococcus aureus is the most common cause of skin and soft tissue infections, even more common than Streptococci. Please remember this. But what really stands out for this bacterium is its invasiveness and its ability to infect deeper structures of the musculoskeletal system, especially joints and bones. Whenever you see a patient with septic arthritis or osteomyelitis, Staphylococcus aureus should be at the very top of your list of suspects. It's also very quick to enter the bloodstream and spread to the heart valves, where it causes endocarditis. And from the heart, of course, it can spread everywhere and reach even more bones, muscles, and even the brain. So whenever you see a skin or soft tissue infection or bone infection, again, Staphylococcus aureus is one of the causes you will always consider, especially if there is an abscess. A skin, soft tissue, or bone abscess is practically synonymous with Staphylococcus aureus. Now, its weaker cousin, Coagulase-negative Staphylococcus, is almost always an innocent bystander and a skin contaminant. Occasionally, it can cause wound infections or bloodstream infections, but it needs a lot more help than Staphylococcus aureus. It needs a Trojan horse to circumvent the patient's natural defenses, usually in the form of contaminated foreign material, like an artificial joint, a pacemaker, or a central venous line. Something that bypasses or penetrates the patient's skin. That's how it gets in and causes infection. Meaning, Coagulase-negative Staphylococcus is almost always, almost exclusively, a hospital-acquired pathogen. I emphasize again, as opposed to Staphylococcus aureus, which is insanely virulent, Coagulase-negative Staphylococcus is not virulent enough to cause infections on its own. It needs help, it needs a contaminated implant, or at least something that will penetrate the skin of the patient and prepare a highway for this bacterium to invade and cause a true infection. Most of the time, it's simply a contaminant. Staphylococcal infections in general are more difficult to treat than streptococcal infections, but there are similarities and shortcuts that we will cover in the upcoming lectures. Okay, so much about gram-positive cocci. What about gram-negative bacteria, the ones that appear pink on gram stain? Well, the ones that matter are most commonly shaped like rods, meaning bacilli. There are also, of course, gram-negative cocci that are extremely important in human medicine because they can cause all sorts of severe infections, and we will mention them in later lectures. But in terms of antibiotics, in terms of antimicrobial susceptibility, gram-negative cocci are generally much easier to kill than gram-negative bacilli. So, for the purpose of learning antibiotics, you can simply put them all into the same category, because once you learn how to cover gram-negative bacilli, covering gram-negative cocci is a joke. So, let's start with the most famous gram-negative bacillus, E. coli. Now, this bacterium needs no introduction. I'm sure you know that E. coli is the most common cause of urinary tract infections, ranging from a simple cystitis to pyelonephritis all the way to urosepsis. But its natural habitat is the gut, the intestines, and there it usually causes absolutely no problems. Usually. But when it finds its way out of the intestines and ends up in the urinary tract, or the gastrointestinal wall, the parenchyma of neighboring organs, or the bloodstream, it causes disease. What this means for you is that in practice, whenever you see a patient with a urinary tract infection or any kind of intra-abdominal infection like cholecystitis, cholangitis, diverticulitis, an intra-abdominal abscess, peritonitis, or anything involving the gut, You will always make sure that the antibiotics you choose reliably cover E. coli, among other things. Another thing to point out is that E. coli and other gram-negative rods are able to survive in the environment for quite a bit of time, and they often contaminate objects and surfaces in hospitals and nursing homes. They are literally everywhere, and in bedridden, functionally impaired patients, these bacteria tend to displace the normal flora and colonize the skin and the upper part of the respiratory tract, especially if the patient is hospitalized for more than a few days or frequently exposed to antibiotics and healthcare in general. It's no wonder then that gram-negative rods are the most common cause of hospital-acquired infections. Here, it's not even E. coli that is most significant. There are many other similar bacteria like Klebsiella pneumoniae, Enterobacter, Proteus, and many others, but for now, you can think of all of them as simply close relatives to E. coli because the infections they cause are pretty similar to the ones that E. coli causes, so we can put them all under the same category for now. However, there is one bacterium within this group that does deserve a special mention as the undisputed king of hospital-acquired infections and the poster child for antimicrobial resistance, the one and only Pseudomonas aeruginosa. It has an unparalleled ability to colonize all kinds of surfaces in the environment and survive there for a very long time, especially if there is moisture. So think toilets, sinks, faucets, respirators, humidifiers. On the body, think chronic moist ulcers like venous ulcers, or thick mucus that accumulates in the lungs of patients with COPD, bronchiectasis, or cystic fibrosis. In short, hospitals, frequent exposure to antibiotics, and moisture, think Pseudomonas. Now, all gram-negative rods can acquire all kinds of resistance mechanisms to all sorts of antibiotics, usually by acquiring mobile genetic elements like plasmids that encode for a certain protein or enzyme that confers resistance, sort of like a piece of computer code, a patch for software. But the thing that makes Pseudomonas so special is its innate resistance to antibiotics. Even wild-type Pseudomonas that hasn't acquired any resistance mechanisms from other bacteria and it hasn't been exposed to antibiotics is already resistant to many antibiotics to begin with. In fact, this bacterium is so widespread in hospital settings and its intrinsic resistance to antibiotics is so vast that it influences the very way we categorize antibiotics. You will see what I mean in the next lecture. Okay, the bacteria that we covered so far are aerobic bacteria, but there are also anaerobic bacteria. Now, just like aerobic bacteria, anaerobes can be gram-positive, they can be gram-negative, but most of the time we put them all under the same category because most of the time we cover them with the same antibiotics. Not always, but again, generally we do. What I would like you to remember here is that obligate anaerobes die when exposed to oxygen, meaning they can only live where they are not exposed to air for very long, mostly in the gastrointestinal tract and the genital mucosa. And their sensitivity to oxygen is the reason why they also inhabit abscesses. Abscesses are enclosed collections of pus. And when you put all of this together, the gut, meaning intra-abdominal infections, and abscesses, you will come to the conclusion that I always point out in my lectures on anaerobes. Many anaerobic infections cannot be cured with antibiotics alone. Please remember this. Many times they will need to be physically removed in addition to being treated with antibiotics, which means in addition to antibiotics, most of the time for anaerobic infections, some kind of surgical procedure will be required. Either an abscess will need to be drained or dead devitalized tissue will need to be removed, something like that. Now you know what are the most common and the most dangerous bacteria that we cover with our antibiotics. You know where they are on the human body and you know what they can do. Again, obviously, these are not all bacteria in existence. This is not the point. Otherwise, there wouldn't be much need for infectious diseases specialists, right? But let's start simple by building a strong foundation that will work 90% of the time. And once this becomes second nature to you, then we can discuss the remaining 10%. As always, you can download this PDF on my website, and the link is right here in the description. With what you learned in this lesson, you will have absolutely no problem understanding the most important and the most widely used group of antibiotics, and we will discuss them in the very next lesson. So, if you haven't done so already, make sure you subscribe so that you don't miss it. Take care.